This presentation is going to cover the concept of healthcare quality. Goals for this concept presentation will be that the student will be able to define and describe the concept. The student will discuss the underlying theory of quality, and the student will identify the context of healthcare quality in nursing and healthcare practice. So, healthcare quality is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Let's take a look at this definition in terms of nursing. So, we are providing nursing services for our patients or families or communities, and the services that or the nursing actions that we are doing, our ultimate goal is that we have patients, families, or communities achieve desired health outcomes. Who identifies those health outcomes? Well, they're identified nationally. First of all, within the organization. The organization will set certain benchmark scores that they want patients to achieve. And organizations will look to what's happening on the national forum. So one of the websites that you will be looking at in your WebQuest activity is the National Quality Indicators website. And that website is going to go through all the nursing quality indicators that nursing will use to measure the quality of nursing services. And they have to be consistent with current professional knowledge. So we look to the evidence and the research to ensure that the outcomes or the benchmarks that we're setting are appropriate with current research. Healthcare quality is quite multifaceted. First of all, quality is seen on a continuum, from consistently poor outcomes on one end of the spectrum to consistently optimal outcomes on the other end of the spectrum. Healthcare and nursing are always striving for consistently optimal outcomes. If we did not, we would not be in business very long. So quality has 6 components that are very important that will ensure that we are getting to our optimal outcomes. First and foremost, it has to be patient-centered. We need to be providing culturally competent care and considering the needs and desires of our patients. Next, we're looking at patient care outcomes. Those are the national quality indicators that, or the benchmark scores that I discussed in the definition. Now, health care outcomes also takes into account patient satisfaction. So where the healthcare organization might use those measurable national quality indicators as deciding that the services it's providing its patients is quality care, if the patient leaves with those consistently optimal outcomes but doesn't feel that he received quality care, then we're still not doing our job. It's equally important to take into account the patient's perception of quality, hence going back to patient-centered care, so that we know their perceptions of quality care and that we're meeting those as well. Safety goes hand in hand with quality. For if an organization does not develop a culture of safety or is ridden with many errors, patients who have errors are not going to be receiving optimal outcomes. So you can see how the two go hand in hand. And again, one of the websites that you're going to be going to is QSIN, which is Quality and Safety in Quality, Safety, Education in Nursing. So you see quality and safety are pretty much married to each other. I just discussed how all the benchmark that we set and the nursing services that we provide must be based on current research and knowledge, or make it evidence-based practice. Finally, we as nurses need to provide the most amount of care with the least amount of resources to ensure that we are also considering healthcare costs and we don't overutilize resources. Sometimes people think more is better, but actuality, less is better sometimes. However that cliche goes. Keep it short and simple. Could be another logo that you think about with resource efficient care. So as you're going through your WebQuest activities, I want you to consider what it means for an organization to have a culture of quality. What do you think, what are the behaviors that have to be present within that organization for this type of culture to occur? And what do you think the potential barriers are? This is important for you as professional nurses because our program wants to develop nurse leaders of the future. And you need to consider what must be present, what the behaviors that must be present, so that you can help either enhance the culture of safety or change it to a culture of safety by being that change agent and knowing what the potential barriers are so that you can look to the evidence and see what interventions are needed to remove those barriers. Again, trying to be that change agent in that organization. Healthcare quality has both major and minor attributes associated with it. The major attributes, first of all, includes safe care. As I stated earlier, safe care and quality care are married together. The two go hand in hand. We need to be diligent about avoiding injuries to our patients and know what the standards of care are and practice within those guidelines. Next, we have to make sure that our care is effective, that we offer the services that are most important for our patients and address the needs of the population served. Finally, efficient care means that transitions are coordinated and seamless, that we monitor costs, we minimize lengths of stay, and we work well with the least amount of resources to get us to our quality indicators. You can refer to Table 46-1 in Giddens for a more descriptive view of the major attributes. Moving on to the minor attributes, we need to make sure that our care is timely, that we limit wait times and provide faster service. First of all, that's going to improve our patient satisfaction scores, as well as if we delay nursing services or nursing actions or any kind of health service, it can actually lead to poorer outcomes. For example, if we delay turning our patients, we only turn, we say we're going to turn them every 2 hours, but we didn't get to them till 4 hours later, we can actually increase the incidence of pressure ulcers. Next, minor attribute is that we practice patient-centered care, that we're respectful, we provide culturally competent care, and we take in the patient's needs, values, and preferences. Finally, our care needs to be equitable. We need to provide quality care for all, irregardless of race, age, gender, socioeconomic status. Looking at the major theory behind healthcare quality is this Dunn-Abadian model of structure and outcomes. In this model, quality is designed, or quality comes about through the interaction of three things: organizational characteristics, or the structure, the process, and the outcomes. So the organizational characteristics or structure includes the healthcare workers within the organization, any kind of equipment and technology that is available. For example, has the organization adopted a physician order entry system, electronic health record, so that we can provide the most up-to-date, safe, quality patient care. Next, we look at the processes, the interactions between all healthcare workers including the patient? Are these processes including patient-centered care? And we have to make sure that we deliver results reliably. And are they the same every time we deliver them? Because obviously we want this, again, care has to be equitable. And finally, quality is defined through our outcomes, be it clinical outcomes or patient perception of care or their level of satisfaction. One other thing to add to outcomes is financial gain for the organization, be it non-for-profit or for-profit. Well, obviously for the for-profit, those gains are going back to the shareholders, but the non-for-profit, as well as the organization, and same with the non-for-profit, all those gains go back into the organization so that they continue to maintain their characteristics and processes appropriately and continue to research, have the availability of personnel to look to the evidence to be that learning organization and make changes within. So all these three work together to provide healthcare quality. So going to error reduction, which actually is about safe practice, all healthcare facilities should be looking at reducing errors so that they provide safe care. There are two types of errors. We have errors of execution and we have errors in the health plan. Errors of execution, there's three types. There's the failure of a planned intervention. So the intervention that we didn't work. So what are we going to do about it? There's the failure to complete an action as intended. So maybe someone didn't follow a policy and procedure appropriately. And then there's variations from the standards of care, which if you want to protect your license, you need to make sure that you are providing nursing care within the standards of care. Again, standard of care is what any reasonable and prudent nurse in healthcare would do with similar circumstances and similar resources available to them. It's almost like the minimal amount of care that's going to produce safe, quality care. Errors in health could either be the wrong diagnosis was made or the wrong treatment plan was written. So healthcare facilities have learned to look at errors more as a system failure. We realize that humans make errors. And we have found, back when I was a nurse, when nurses made an error, we had to write up an incident report and the nurse was blamed. In fact, if you had 3 incident reports written up against you, you were going to be fired. They have found now they're looking more at the just culture. They're recognizing that money errors are made not because human beings don't follow policies or procedures or they just don't care about those things. They find that maybe the policy and procedure or the systems that they put in place are flawed. So they look at the system and we still write up incident reports. The incident reports go off to risk management. The risk management team looks at these incident reports. They will look at similar errors that are happening. It could be a certain medication error that keeps happening, maybe related to heparin. And they will cluster the data that is written up in these incident reports and actually make a diagnosis about the system, just like we cluster nursing data and make a patient nursing diagnosis. So then they're going to look at the evidence and see what are other organizations doing, or is there any research that maybe doesn't support what we're doing anymore, and we need to update this part of the system. And they will kind of create different strategies to improve the system. Then they will implement it, and obviously, just like in nursing care, we have to evaluate the effectiveness of these new interventions that have been implemented. Healthcare organizations are complex adaptive systems, and errors occur because of human error compounded by system design failures. So again, the movement is to adjust culture. Let's fix the system, and hopefully we can reduce errors. And the other thing is there are 3 types of errors that can happen. There's the near miss, meaning the nurse maybe came to the bedside with the medication for a patient, and when she was doing her 2 checks, recognized that she had the wrong patient. But she had the medication for another patient, but she didn't administer it because she was following a system policy. 2 checks, 2 identifiers with the medical administration record open. So that did not reach the patient. Patient was not injured. However, that nurse needs to be accountable for her near miss and write that incident report up, because it's being professional and responsible to send that incident report to risk management so they can say, oh good, a patient injury didn't happen. But if they get a lot of clusters of these near misses, they can look to see what sort of system change they can make, so that, because one of these near misses could become an adverse or sentinel event. Now, an adverse event is there was a moderate variation in the standard of care, and it reached the patient. However, there was minimal or no harm to the patient. And a sentinel event is severe variation in the standard of care, reaches the patient, and can result either in death or major harm to the patient. So if we write up those near misses, we want to prevent those adverse and sentinel events from happening. So basically what I just described, what the risk management team does, is the root cause analysis. It is they go through a formal process, much like the nursing process, where they define the errors within the system. They identify the risks associated within the tasks of or procedures and policies of the system. Then they will develop and test prevention strategies, implement them, adopt them, and I think one piece missing here is evaluation. It's a continuous loop. We evaluate, we may have to tweak things, you implement the tweaks, you evaluate, just like in the nursing process. Modification to the care plan, modification to the system care plan. And I like this little visual about the root cause analysis basics. We have the problem at the top, we can see it on the surface, and we're looking for the underlying cause below the surface. Kind of like knowing pathophysiology, the underlying cause of the disease that's on the surface of the patient. There is another type of analysis done in healthcare organizations that prevent the occurrence of errors or system failures. And this is the failure mode effective analysis strategy. It assists in producing positive results to decrease certain risk factors. For example, ventilator-assisted pneumonia. So this is another, again, a formal process very similar to the root cause analysis, defining the problem, analyzing the cause, finding the solution, evaluating the results. Again, very similar to the nursing process. So healthcare quality is a huge concept in healthcare, and we need lots of regulatory agencies to monitor healthcare organizations to ensure the safety of the public and ensure that the public is getting safe quality care. Two big bodies that ensure this are the Centers for Medicare and Medicaid Services. They provide oversight for reimbursement issues and are definitely looking at the quality of care. And are looking at nursing sensitive issues, so the nursing quality indicators as well as medical quality indicators. We also have the Joint Commission. Its goal is safety and quality, and they developed our national patient safety goals that are continuously revised And the WebQuest activity that you have does take you through the Joint Commission website, looking at those national patient safety goals. When those first came out, they really targeted acute care facilities, but they have actually increased the number of national patient safety goals within acute care agencies, but they've also developed a set of goals for long-term care agencies, outpatient facilities, recognizing that each type of healthcare organization had its own little specificities associated with it, and those national patient safety goals needed to be tweaked according to the organization. Then we also have advisory bodies within healthcare, and they kind of help advise national healthcare. You will be in the Institute of Medicine website. This provides unbiased advice to improve the nation's health using evidence-based practice. The National Quality Forum, which improves healthcare quality through performance measurement and public reporting. So healthcare organizations part of National Quality Forum will actually be transparent in how they measure performance and make it available for public reporting so that patients know which organizations provide the best quality care. And then we have the National Database for Nursing Quality Indicators, part of your WebQuest activity. And this is basically looking at nursing care and its relationship to outcomes. And finally, there's the National Center for Nursing Quality, which also addresses patient safety and quality in nursing care and looks at nurses' work lives as well. Other quality initiatives out there that are identified in your textbook is the quality plans and philosophies. One is the Plan, Do, Study, Act model, and then there's the Leapfrog group. And health information technology is an exemplar of healthcare quality. It helps improve quality because it enables use of data mining so that we have our benchmarks, we collect data, and we can either raise our benchmark, lower our benchmark, make decisions based on the data mining, and it's a quick way for us to gather that data and look at it. It also helps coordinate the care of our patients and provides seamless communication for multidisciplinary teams. It improves legibility so that there's no mistake about what was ordered or what nursing was doing or what physical therapy was doing. And it helps us translate new evidence into practice. We can, a lot of healthcare facilities on their intranet have different websites that we can go to see point of service care, what the newest and greatest is that they're doing for certain diagnoses. Then we have our interrelated concepts with healthcare quality, health policy, healthcare economics. You saw that we need to be providing efficient care. That's where healthcare economics comes into play. Healthcare organizations, because that's where we're providing this quality care. Safety and quality are married. Technology and informatics, the electronic health record, physician order entry, those are all exemplars of healthcare quality. And health policy, we have all those advisory groups that and regulatory agencies that help drive our nursing practice. And much of our practice is guided through the Department of Health and Human Services. These are the exemplars associated with healthcare quality. This completes the lecture portion of healthcare quality concept. You can now move on to your WebQuest activity, and I look forward to seeing you on the discussion board. Thank you. Please feel free to email me with any questions.